I think that one probably important implication of some of the data we heard is that when you are measuring these rapid declines in anaerobes that you get after treating with metronidazole or clindamycin, you're really seeing what's going on in the planktonic environment, right? So all these bacteria that are just in the lumen, and this, we have no good data to say what's happening at the level of biofilm. I have not seen a real prospective study that was adequately powered and done to show that you pair that decline in those anaerobes, perhaps with some persistence at the biofilm layer, which would be really fascinating. And then if you compared that with a regimen that's going to target biofilm disruption post-antibiotics, which, you know, that's being done. That was there are some studies underway, but it would be very, very interesting to look at the anatomy and do some specific assessment of whether that biofilm is the nidus that continues to harbor the recurrence bacteria. So I think it's a great area. Once again, the clinical trials are ahead of our understanding of the pathophysiology and the natural history.
Could you say a little bit more about those clinical trials? Because you yourself have done one with boric acid.
Sure. So there is a new boric acid EDTA, and that's the difference with the old version of the boric acid that you can just get over the counter. And this is a proprietary product that is under investigation right now that combines those two entities and was looked at in a study in women who had VVC or vulvovaginal candidiasis or both, and showed efficacy that was quite good for VVC, surprisingly, or not surprisingly, given that we know the boric acid treats azole-resistant Candida species. So showed about over 90% eradication of the Candida or cure in the absence of another antifungal. And then with BV did about as good as our standard treatment, so about 58% cure. So I think it's promising. You know, it isn't going to be a full answer. It may have a role in suppression and is being studied in suppression right now post-antibiotic therapy. So it'll be interesting to see how that goes.